start recording the session so that folks who are unable to participate today are still able to take advantage of the presentations. The first one we have is the Medicaid dental benefit from Delta Dental. And we have Ann Schwartz on the phone, and she can discuss more her role with this entity as well. And then we have Shanna Peterson, who will then be talking about non-emergency medical transportation after the Delta Dental session ends. And so as people are joining the call, just to make sure that your phones are on mute, and then if you're joined by both the web platform and the phone line,
when I'm off this
make
webinar,
sure that you are
I will get them down for you.
Muting on both of those as well.
I can.
I think we have some background noise right now, so if someone wants to check their phone and make sure you're muted, then we can get started. And then if you have any questions, feel free to enter them into the chat box ongoing during the presentation, or after each of the presentations conclude, we'll have kind of a question and answer time if anyone has questions at those intervals of time. Okay, I think we are muted. Ann, do you want to begin?
Yes, thank you, Ashley. Just to make sure, are you able to hear me?
Yes.
Okay. Well, as Ashley said, my name is Ann Schwartz. I work currently with Delta Dental of South Dakota, and some of you may be familiar with my name. I previously worked with the Division of Developmental Disabilities, and I have now been with Delta Dental since June of this year, and I was really excited to get the invitation to share this information today, because I feel very strongly that it's important for all of you as case managers to understand the dental benefit that is available to the people that you are supporting through case management. And I'm really looking forward to your questions at the end of my presentation. I'll walk through the slides, and then any questions that you have, as Ashley said, please feel free to share through the chat function. I'd be happy to answer them at the end. And it's kind of funny because I was just sitting here thinking that I probably should have brushed my teeth after lunch, because one of my newest employees is sitting next to me, and I am thinking, like, I'm very self-conscious right now about the way my breath is smelling. And I think that's something that we can all relate to as we talk about oral health. And so just to start out today, I wanted to share some information generally about oral health. I think it's something that we all can kind of relate to when we get up in the morning and we kind of have that dry or kind of, maybe not smelling too good breath. And I know that for myself, one of the first things I do when I wake up in the morning is brush my teeth. And I'm sure all of you have your habits, just like I do. Maybe you wait till after breakfast, or you wait till after you've had your coffee. Some of you might brush your teeth after every meal. That's really something we should all aspire to. Some of you might brush your teeth twice a day. Maybe some do more often. I know, again, for myself, I have a hard time going to bed at night unless I brush my teeth. So I think we all have our oral health habits. And I think if you put yourself in the position of the people that you support, you can start to think about how those oral health habits might be more difficult for some of those folks. Some of them might not be physically capable of brushing their own teeth. Some of them might have some sort of sensory aversion to either the toothbrush or to the toothpaste, depending on what the flavor is. And so having those oral health habits may be more challenging for some of the people that you provide case management to. And, that can lead to a struggle, not only for the person, but for maybe the people that are providing the direct supports for them. I know when my kids were younger and they would maybe put up a little fight about brushing their teeth. Sometimes it was easier just to say, okay, you know what, we're not going to brush tonight. I can't, like it's one fight I just don't have in me today. And so I think when you think about the people you're supporting, the ones that maybe have some behavioral challenges that may go along with good oral health habits, you can see how maybe brushing would become less of a priority than other activities, because sometimes it's just easier not to brush here and there than it is to fight the brushing. That then can lead to poor oral health. And unfortunately, some of our habits don't lead to worse things, but not brushing your teeth and not having good oral health practices can lead to things that create more challenges for ourselves and for the people that you guys are supporting. So one of the things is it can lead, of course, to disease infection. People can start to have cavities and other decay of their teeth. They can have, develop gum disease. There's lots of different things that can happen when people do not have good oral health habits. It can also lead to significant health issues, and this kind of goes along with the bottom bullet too, that it can increase the risk of symptoms of heart disease, stroke, and dementia and diabetes. There's a lot of medical research that's currently being done about the connection between oral health and medical health symptoms. So for example, it's been proven that untreated periodontal or gum disease can lead to a worsening of diabetes and vice versa. So diabetes can get worse if you're not taking care of your gums, and your gums can get worse if you're not taking care of your diabetes. And so again, knowing that a good portion of the people that you are supporting through case management have other health issues, oral health is one additional way to kind of help people have better health overall. Of course, if you have poor oral health, which results in decay, cavities, infection, that can lead to having pain when you're eating, which then can lead to poor nutrition. We'll talk a little bit about things you can do as a case manager later down the road in the presentation. But one of the things is to remember that if somebody is maybe having some new behaviors, part of the reason could potentially be that they have some pain in their mouth. I just think it's really important to remember that people supported by the developmentally disabled system, either through the waiver or otherwise, have lots of barriers when it comes to getting a job, creating relationships, meeting people, and developing that social capital that we really want them to develop. And so we don't want poor oral health or bad teeth or bad breath to be one of those barriers if that's something that we can somehow prevent from happening. So I would just encourage all of you to be thinking about that related to the people that you support. Some good oral health practices, these are pretty straightforward, but again, just want to put them out there. Brushing twice each day at a minimum. It's really better to brush more, but I know I don't. So, at least if we do it twice, that's good. Flossing daily, visiting the dentist for regular prevention. It's important. We talk a lot here at Delta Dental about people having a dental home, which means someplace where they have a relationship with the dentist knows the individual, they have a history of their oral health, their cleanings, and their other work that maybe they've had done. If there's a problem with the individual, you can call that office and get in because they have a history. And so we really want people to be, getting those regular prevention visits. We'll talk a little bit later, I know for this population that can be challenging, and there are some folks that simply can't go in and sit traditionally in a dental office, but we will talk a little bit about some of the options that are open to those folks. We also want to talk a little bit about the Medicaid dental benefit, just give you some background on the dental benefit. So the Medicaid state plan, I just want to kind of give a brief overview of what that is. Basically, the state plan is kind of a contract between the state and the federal government that outlines what will be covered by Medicaid. So every state in the United States has its own state plan. And there's a saying that goes, if you've seen one state plan, you've seen one state plan, because every state has its own little nuances, its own unique limitations on services. But the state plan is really, it's a long document. It's available on the Department of Social Services Medicaid website if you're really interested. But it's a long document that outlines all of the types of services that will be paid for by Medicaid. And it outlines, will they be paid for, won't they be paid for, and if there will be limitations. And so that's important to the conversation today because dental services are part of a Medicaid state plan when a state elects to provide them. So states, as they're developing their state plans, and of course, all states at this point have them well developed. I mean, they've been developed since the late 60s, early 70s. But every time a change is made to the state plan, a state does something called a state plan amendment, or a SPA, where they'll submit to the federal government what is going to change in the state plan, and then the federal government will ask questions and either approve it or deny it. So some services in the state plan are required, which means every state has to cover them. And so those are things like inpatient hospital stays and outpatient clinic visits, prescription drug benefits, long-term care like a nursing home. All of those are things that states are required to have in their state plan. They're required to cover them. Dental benefits are an optional service. And so some dental benefits for kids are required because they are required under early periodic screening and diagnostic and treatment. So they have to be covered for kids. But in particular, the adults, states are not required to cover dental for adults. And so the South Dakota population, Medicaid population, is very lucky because South Dakota has elected to provide dental benefits not only for children, but also for the adult population. And I will say that there are states that have not elected to do that. And so just the fact that Medicaid recipients in South Dakota adult Medicaid recipients have dental benefits is really, really a good thing. And it's not nationwide that exists. So, of course, just like any Medicaid service, in order to have somebody receive it and have access to it, you have to have providers. And so providers have to enroll with South Dakota Medicaid in order to receive reimbursement. This is a similar process to any other agency like your case management agencies, RHD and Benchmark, Lifescape, New Horizon. They all had to enroll with South Dakota Medicaid in order to provide case management services and receive reimbursement for doing that. Dentists have to do the same thing. It means they have to provide information about their license. It means they have to provide their national provider identification numbers. They have to do all these different things. Right now, there are over 300 providers that are enrolled to provide dental services in the state. I will tell you that many of those see limited Medicaid patients. They, may be enrolled, but they may not actually be accepting new patients, and that's really up to the dental provider. If they determine that their caseload is full at their dental clinic and they determine that they're no longer going to accept Medicaid patients, but they're going to continue to see the current Medicaid patients they have, that is something that they can do. We have dentists enrolled with us that are in private practice. I'm sure you all have a dentist who's probably in private practice. We also have providers that are practicing at community health centers like Horizon Health. We have Falls Community Health in Sioux Falls. We have Community Health Center of the Black Hills in Rapid City. And then we also have dentists that are that are in the Indian Health Services. So we have 10 Indian Health Service units, and we have 2 tribally run dental clinics in Flanger and Eagle Butte that also provide dental services to people who are eligible for services through Indian Health Services. So the people that you're supporting through case management could potentially access care in any of those types of settings. So just to talk a little bit about Medicaid coverage. Coverage is limited to certain services. It's not unlimited. Of course, because we're talking about Medicaid dollars and those are funded through taxpayer dollars, we have specific services that are covered that have been identified by South Dakota Medicaid. And I should just say, and I probably should have said this at the beginning, Delta Dental is involved because we have the contract with South Dakota Medicaid to administer the dental benefit. So South Dakota Medicaid has essentially said, hey, we don't want to develop the capacity it would take to do the dental benefit within South Dakota Medicaid staff. So we're going to look for an outside organization that knows more about dental and can actually provide this service. And so Delta Dental of South Dakota has had the contract with South Dakota Medicaid since 1996. So just over 20 years, we have been administering the Medicaid dental benefit. That means that all of the dental claims come to our office and we actually pay them. And then we work with DSS for reimbursement. So that's why Delta Dental is involved here, and I'm sorry I didn't say that up front. So coverage, again, is limited. South Dakota Medicaid identifies which services are going to be covered by Medicaid, and then they have a fee schedule that is posted on their provider website. And that's what we do then. We take that fee schedule and we say, okay, these are the claims we're going to pay and these are the claims we're not. And so there are services that are not covered, and I'll talk a little bit about that. There are differences in coverage for children and adults. In general, children have fewer limitations than adults. More services are covered, and children are more likely to be able to get the care that is needed than adults are. And so I just wanted to touch on, I know some of you provide supports to some young people who would probably be considered children by South Dakota Medicaid, but in general, your bulk of your population are adults. So I'm going to talk about adult coverage. So these are the services that are covered for adults by South Dakota Medicaid. You can see that we cover 2 exams and 2 cleanings per year. We cover fillings, x-rays, removal of teeth, which is also known as extractions. We will do permanent crowns on front teeth, and then if someone needs a crown on a back tooth, they might need to get a stainless steel one. There are root canals that can be done on front teeth. And then we will do reimbursement for partials or dentures, but that's only once every 5 years. And that's important because, especially with the population of people that are being supported through the Division of Developmental Disabilities, folks may not be super responsible with their dentures or with their partials. And so it's really important that the care providers are making sure that those things are not being thrown away or somehow broken or lost, because Medicaid does have a limitation of once every 5 years for those items. We do have a process for prior authorization, and there are some services like dentures, as an example, that do require prior authorization. And so the dental office will take the steps of submitting information to Delta Dental, and we have a group of folks here who review those and make determinations on if a service was needed. We also have a process for special consideration. So if there's something that a dentist believes that someone really needed, or there was some sort of special circumstance, we do have a process where we can kind of make some special considerations on those things. The next slide is things that are not covered. So you can see that we don't cover for adults. Again, this is not covered for adults. The fluoride applications, so some of you may be aware, if you have children, about fluoride varnishes or about sealants. Those are typically something that is covered for children, but not necessarily used for adults. And so that's listed here as a non-covered service. We also don't cover those permanent crowns on the back teeth, root canals on back teeth. If somebody's missing, say, one tooth, we won't cover a bridge to fill that gap. We don't do implants, and we don't do braces for adults. And then, of course, all Medicaid services have to be medically necessary, and so cosmetic procedures are not covered. They have to be needed medically by the person. I want to just talk really briefly about the $1,000 annual maximum, because if you have a person that you provide case management for who reaches the $1,000 limit in a year, they may receive a bill from the dental office that they would then be expected to pay. The annual maximum became effective in 2012, so it's been around a while. And when you look at the numbers, a very small percentage of adults on South Dakota Medicaid reach the maximum. But Medicaid adults have coverage for prevention and restorative treatment up to an annual cap of $1,000 per year, and that per year is the state fiscal year, July 1 to June 30th. Emergent dental services, and I'll define that on the next slide, and dentures do not apply towards the cap. So exceptions can be made for people. For example, if somebody has an infection in a tooth and the tooth needs to be extracted, that would likely be considered an emergency, and then the payment for that emergency would be exempted from that $1,000 maximum. So there are situations where people, in particular people with developmental disabilities, need to have multiple services done. Maybe they haven't been to a dentist in a while, but they need multiple services, and it's just not going to be possible for those folks to sit in the dental chair and have that work done. And so you may be aware that some of your clients have gone into the operating room and had those services done under general anesthesia. We can make some exceptions for those kinds of folks under the $1,000. So for example, say that you have a person that you support, they go to the dentist, and the dentist looks in their mouth and says, hey, this person has 8 cavities. The cavities are not so bad that they would be considered an emergency. The person's not at risk for having the cavities yet, but we know that if we don't fix them, the decay will likely get worse and they might turn into an emergency. And so the dentist says, hey, let's take this person into the operating room. We don't think they're going to be able to sit in the dental chair and do this work. So we're going to take this person into the operating room and fill all of these cavities at the same time. That might, under normal circumstances, meet the $1,000 cap, because each cavity filling, or maybe the person needs a root canal, or maybe they need a crown, each of those things would add up and potentially would be in excess of $1,000. But for the developmentally delayed population, we can make some exceptions to that in order to get all of that work done in one setting rather than having to go back into the OR a second time. So emergent dental services, as I mentioned, are medically necessary to immediately alleviate severe pain or acute affection. So it's just important to remember that if you're talking about somebody who has had some severe pain, likely the dental office will submit that to us as an emergent need, and then that will be exempted from that $1,000. If somebody does meet the $1,000 limit, and again, it's a small percentage of folks that do, but if someone does, then they would be responsible for the additional costs, but those should be billed at the Medicaid rates, not at the provider's usual and customary rates. I'm sure all of you have seen the South Dakota Medicaid Recipient Handbook. That's a handbook that everybody who becomes eligible for Medicaid receives. There's an electronic version of the handbook available on the DSS website. But that handbook talks through what are the patient's rights and responsibilities. And the lists in the handbook are more extensive than the list that I've included here. But these are some things that I just wanted to highlight as, responsibilities and rights that patients have when they receive services from any medical provider, which includes the dentist. And the folks that you're supporting through case management might need help understanding and putting these rights and responsibilities into practice. So again, these are taken from the Medicaid Recipient Handbook, but they have, of course, the right to be treated with respect, and they have the right to understand what their treatment options are. That might be something that would be shared with a guardian if they are not their own guardian, or it might be something that they need help understanding how to make a decision between having, for example, a tooth have a crown versus a tooth be extracted. That might be something that they would need help understanding what that means and what the outcome is on the other side. On the flip side, they also have responsibilities, and the two that I really wanted to highlight today are that their Medicaid ID card needs to be shown to the dental office. The dental office is responsible for ensuring that somebody is eligible every time the patient comes in. So every time they can have their ID card ready and available, that's really helpful to the dental office. And then they also have the responsibility, just like we all do, to keep appointments or to call the office if we have to reschedule or cancel. You know, dental offices hold aside time for their appointments, and it's really difficult for dental offices when patients simply miss their appointments and don't call. And many dental offices actually have policies around the number of times that someone can miss their appointments before they will be dismissed from the practice. And I would hate to see a person with a developmental disability who has developed a relationship with an office and has a comfort level with an office have to be dismissed from that office because they're not keeping their appointments. There's lots of reasons why people don't keep their appointments. I know often I will reschedule appointments or cancel. And in fact, a few weeks ago, embarrassingly, I just simply did not go to an appointment and I did not cancel. And I thought about it. It was not a dental appointment, but it was an appointment nonetheless. And I felt terrible the next day that I had forgotten about it. But those are things that are really challenging for dental offices because they hold aside specific time for that patient. And if the patient doesn't come, that is time that they're setting aside that is not being utilized. I did want to mention really briefly the Caring for Smiles program is something that Delta Dental established quite a few years ago now. It can be really difficult, as I've talked about a couple of times, for people with developmental disabilities to sit in an office chair. I mean, it's hard for many of us. I know I am not the biggest fan of going to the dentist, and, you know, it can be a scary thing for people who don't have challenges. And so for people that might have sensory challenges or a discomfort with new people, it can be loud, it can be scary, it can be painful to go to the dentist. And so it can take a lot of time to help people in this population establish a comfort with the dentist and with receiving services in the dental office. And there are times when it could require multiple visits prior to any work actually being done before they're comfortable. And a lot of times we'll see that with kids as well, that people will start bringing their kids. We really recommend that people start bringing their kids into the dentist at age 1. Partially so that we can watch for decay, or the dentist can watch for decay, but also so that the child develops a comfort with the office, with the staff, with somebody looking in their mouth. I mean, it can feel kind of invasive. And so people need a chance to get comfortable with that. And so that's what the Caring for Smiles program really tries to do. It really is aimed at trying to increase access to dental care for patients with developmental disabilities, and to have that dental care be happening in an office setting versus in an operating room. As I mentioned earlier, there are times when people have to go into that OR setting to get their work done, and we recognize that. But we really believe that with the right support, people can be comfortable and develop a comfort in going to the dentist and getting their work done in an office. So there's actually special training that some dental offices have had.
All done.
And will continue to have. We have offices going through this training every once in a while. And they can get special training about how to work with the population of people who are developmentally disabled. And then as a result, they can get enhanced reimbursement and enhanced services for the people that they serve. So for example, they can then do fluoride applications for children and for adults. So they might recognize that, hey, in this population, there are adults that need fluoride for whatever reason, if that dentist has gone through the Caring for Smiles program, they can go ahead and do that for those patients. They can also do 3 cleanings versus 2, and then they would also be able to bill the bottom is a code. I probably shouldn't have left the code on there, but when dentists submit their claims, they submit the codes associated with the service. And that code in particular is a behavior management code. And so when they have somebody come in who may need some additional support, maybe they need a couple of people a couple of assistants in the room rather than one assistant, they can actually bill that code and receive some additional reimbursement from South Dakota Medicaid that makes it more financially feasible for them to serve this population. And if any dentists that your clients are seeing aren't enrolled in that program, they can contact our office and we can get them set up with that. So what's the role of the case manager? I mentioned this a little earlier. First, to ensure that your people that you're supporting have had an assessment of oral health. And that's one of the things that's written out in administrative rule. I've included the administrative rule citation there, so if you want to take a look at it. But an oral health assessment is required, and as a case manager, you should be making sure that your people that you are supporting have had that assessment of oral hygiene practices. You also need to advocate on behalf of the people that you're supporting. So that could include helping them find a dentist, helping them communicate with their dentist, helping them understand what the importance of oral health, helping them understand what their options are if there's various options for treatment, and helping identify the challenges that people might have in a traditional office visit. So that might be something that would come up in a team meeting. If somebody's maybe, thinking about, wow, like this person's, developing some good habits, maybe we want to get them into a dentist. What would be some challenges that this person might have in going to a dental office, and trying to mitigate those before they even come up. And then, as I mentioned earlier, tooth decay can cause pretty severe pain for people, and so you really want to be thinking about that as a possibility, especially since people supported cannot always verbalize their pain or other feelings in a way that's easy to understand for those who are providing those direct supports or for family. So just encourage you to always consider the potential of oral pain if you have a client who is exhibiting maybe a new behavior or some sort of new aversion to eating or drinking or to brushing. Maybe they're not eating hard foods because it's painful, or maybe they're not wanting to chew on one side because it's painful, and then that's causing them not to eat certain kinds of food. Or maybe they start exhibiting, some sort of a behavior that is associated with oral health pain. And I know that can apply to a lot of things, right? A lot of medical conditions as well. And so I know you guys are always thinking of those things, but just wanted to identify that from an oral health perspective. So wanted to provide you some resources today. First of all, the Medicaid Recipient Handbook, I referenced that earlier. It's available on the DSS website. Delta Dental has a call center, and I've listed the number there. So we often will get phone calls from dental offices asking about, if a patient has had a certain service already this year, or what the history of services might be, or if somebody's eligible. Recipients or their guardians can also call that number. So if they are having challenges finding a dentist, or if they're maybe unclear about what a certain kind of treatment means, or if they've had certain things this year already, they can also contact our call center, and we would definitely be able to help them out. Insure Kids Now is a website that states use. It's nationwide, and if you go on there, you can click on Find a Dentist in your state, and you can pick South Dakota, and then you can find dentists who accept Medicaid as a payment source. It is geared towards kids, but it can be a good resource just to find a list of dentists in a certain geographical area that do accept Medicaid, and then calls can be made to those offices to see if they would accept a patient that wasn't a child. And then care coordination, I wanted to touch on really briefly. We are starting to work on developing some care coordination within Delta Dental as part of our contract with South Dakota Medicaid. So we are kind of in the process of designing what that's going to look like and implementing it. And our goal is to have some additional supports for Medicaid recipients and for Medicaid provider offices, so that hopefully we can help increase the access to dental care for Medicaid recipients. So we will actually have some care coordinators that will help provide some supports for folks within South Dakota Medicaid. But we're going to really try to target that towards people who don't have any other kinds of case management. And so that's one of the reasons that we were excited to talk with you all today, because you already have relationships with the people that you're supporting. We definitely don't want to be duplicating effort. So we want to make sure that you all have at least a little bit of an understanding on what the dental benefit is and what the folks that you're supporting are eligible for, so that hopefully you can help support the oral health of those folks. So again, thank you all. I'd be happy to take any questions. We really appreciate your time today.
Awesome. Thank you, Anne. So yeah, if anyone has any questions, you can take a couple moments to ask those. Otherwise, we can move on to the next presentation. I don't see anything here. The chat box. Okay, I will pull up the presentation for non-emergency medical transportation, and then Shanna, you can take over whenever you are ready. So thank you, Anne.
You're welcome. And Ashley, I will just give folks my phone number here as well at Delta Dental. So if they have questions, over the next few days or so, if they come across questions that they feel like they wanted to ask, they can certainly give me a call. But my phone number is, there's a 1-800 number where folks can call. It's 1-800-627-3961. And I can send that to Ashley, and if people have questions about it afterwards too. But again, 1-800-627-3961, and Ann Schwartz if you do have questions later on.
Great, and I put it into the chat box here too, so folks can look at that visually also.
Perfect, thank you.
All right, thank you so much, appreciate it. Okay, as we don't seem to have any questions, Shanna, are you ready to begin your presentation?
Yes, I am, whenever you're ready.
Okay, sounds good. Go ahead, and I think you can begin.
Okay, perfect. So, good afternoon. My name is Shanna Peterson, and I work for the Department of Social Services. I am a program specialist for the EBT office, and then I also help with the NEMT program, which is actually non-emergency medical travel. And so we're just going to kind of talk about what the program is about, what the program does for Medicaid recipients, and some of those requirements in order to get reimbursed from our program. So first off, what non-emergency medical travel does is we provide reimbursement for Medicaid recipients to travel to their medical appointments outside of their city of residence. So for example, if somebody lived in Pierre and they had to go see a specialist in Sioux Falls, they could submit reimbursement to our office for that, and we would be able to reimburse mileage. And then we also reimburse a per diem, and that per diem includes lodging and meals. There are certain circumstances where we can reimburse for airline tickets or bus tickets. Obviously, if somebody has to travel by air, there are requirements that we do need. We need to know that it's medically necessary and that they're going to the closest provider. And so we do get all that documentation, but we like to set up airline tickets directly through our office. We work with AAA Travel, and so in those instances where recipients do need to be flown, we do set that right up, and then we provide itineraries to families. We also set up bus tickets. We have a lot of recipients that utilize bus, and it can be for a lot of different reasons. Maybe they don't have any transportation. Maybe they just don't have reliable transportation. And so we can set up a bus ticket for anybody who needs to get to their medical appointment. And like I said, again, same with airline. We kind of like to set those up through our office. And so our workers set those up and then provide itineraries to recipients for their medical travel. So eligibility in the program, really, in order to be reimbursed by our program, really the requirement really is that you have Medicaid coverage. And so if you have Medicaid, if you have the full Medicaid coverage, you'd be eligible to submit for any travel reimbursement. Other areas within DSS that are also eligible to receive reimbursement for their travel would be those individuals who are on the renal program. And that program just reimburses for renal-related services. So obviously, for those recipients who are only in the renal program, I mean, obviously we can't reimburse for them to go to the dentist or anything in that sort, but it does have to be something related to their renal diagnosis. And then we do cover pregnancy-related coverage only. So those folks who are in that program as well would be eligible to be reimbursed by our program. So the rate of payment, like I said, we reimburse for mileage, and then our per diem includes lodging and meals. So our mileage is 37 cents a mile. We pay a round trip, and we reimburse from city to city. We don't do any in-town travel. It is strictly from city to city. Our per diem, you can see that this does include, like I said, lodging and meals. And so we have in-state rates, and then we have out-of-state rates. And our in-state rates, we do accommodate the tourist season, and so you can see the in-state with lodging rate from January through May and September through December is $81. And then that same rate, or that same lodging in-state June through August is $96 because we do accommodate for that. So that's why that's a little bit higher. We do have in-state without lodging, and we want to accommodate those families where they might stay with family and friends. We have a lot of families who have to travel, and instead of having that lodging expense, they choose to stay with family or friends, or maybe they choose to stay in the hospital if their child is inpatient. And in those instances, we would still be able to reimburse the $26, which is the meal amount. And so we want them to still be able to get some reimbursement for their meals. They just wouldn't be receiving the lodging. And we do have out-of-state rates, and so year-round, that is $101. And then again, if they go out of state and they don't incur any lodging expenses, then it would just be the $26. We do account for an escort or a volunteer driver, and so that's an additional $26. And so in our program, we can reimburse for the recipient and one escort. And so if it's a child traveling, obviously we would reimburse for the parent or guardian to take them. And we have a lot of adults that take an escort, and that it's medically necessary that they have them at their appointment to just be there for support or assistance after the appointment. And so that's what that escort volunteer, driver rate is for those medically necessary escorts. And as I mentioned already, anytime we work with commercial carriers, which would be like the bus and airline, we do like to prior auth and arrange to travel through our office. So requirements for our program, I think one of the biggest requirements that we really look at is, obviously they have to be eligible, but we also want to make sure that they are traveling to the closest facility that's capable of providing the necessary services. So if somebody is resides in Rapid City and is traveling to Sioux Falls for dental services, that'd be something that we would check on in our office and see if it is truly medically necessary, and kind of work with the recipient to see if there are closer services available. The services have to be a Medicaid covered service. So I think for the most part, I think most things are covered by South Dakota Medicaid. There are the exceptions like the gastric bypass surgery and some of those other requirements, transplants that do need a prior authorization. And so if there is any of those would have to be prior authorized first, because we do have to ensure that the services are going to be covered by Medicaid before travel can be paid. We do provide transportation for recipients when they travel to their primary care provider, their health home provider. Again, those have to be outside their city of residence, and so if those services are available within their city of residence, most of the time they're utilizing those services. There are certain exceptions where sometimes, based on the medical needs, that they may need to travel to a provider that is further away. And so we do understand that, and we do look at that, and we just get documentation of the medical necessity and the reasoning that somebody would need to travel to a provider that's further away. We have a reimbursement form that the recipient would take with them to their medical appointment. And so that form has to be completed by the recipient, and then it's also completed by the medical provider, and we'll talk about that form a little bit later. So I kind of touched on the PCP and health home travel already, but like I said, it has to be to the closest. We do not provide any meals or lodging. For the most part, health home providers and primary care providers are in a reasonable distance, so we do not reimburse for the lodging and meals. Anytime travel is required, it would be mileage only. And then you can see here that we say that, again, if you're traveling or if the recipient is traveling to a provider that's farther away, we do require documentation, and then the decision is made as to whether we will allow that. We've seen all kinds of things, sometimes people just have a personal preference, and they want to travel to a provider that might be in a city 10 miles away rather than going to the provider right in their city of residence. And that's fine. We tell them they can go wherever they would like. It's just we wouldn't be able to pay for their transportation. And so when we're talking about the mileage and the per diem that is reimbursed for these trips, mileage does have to be outside of the recipient city of residence. We don't pay for any in-town travel. So in some of those bigger cities, in Sioux Falls, Rapid City, if they're traveling out of state to Minneapolis or Denver, in-town mileage is not reimbursed. So we strictly go from city to city, and our mileages that we pay is usually from like center of city to center of city. We can only pay for one mileage regardless of how many Medicaid recipients are in the vehicle. We do have organizations as well as families that will transport multiple recipients in the same vehicle and get their medical appointments done all in the same day, which is great. But we can only pay one mileage for that. It's not a mileage per Medicaid recipient in the vehicle. And then the trip does have to be completed in order to get reimbursement. If somebody is late to an appointment and the doctor won't see them, if their vehicle broke down, a lot of different instances, the trip does have to be completed. So, lodging and meals, we only pay lodging and meals if the travel is at least 150 miles one way from the recipient city of residence. And so a lot of those travel to appointments in the shorter distance, that's mileage only. It does have to be medically necessary and within that 150 miles to get the per diem or the lodging and meal reimbursement. And so some of the way that we look at that would be if somebody is traveling from here to Rapid City and they have an appointment at 2 o'clock in the afternoon, we look at all different scenarios, but for the most part, they would have plenty of time to drive to their appointment in the morning, not be rushed, and then still be able to return home after the appointment. So even though that trip is over 155 or 150 miles, we would say that lodging and meals wasn't medically necessary. Now, if it was the same distance Pierre to Rapid City and they had an 8 a.m. appointment, then we would consider that medically necessary. We don't want them driving early in the morning. And so we would allow them to go the night before. We reimburse everything after the trip is complete. And so mileage is paid for by the recipient or the family. The lodging and meals are paid for by the recipient and the family. And then our mileage rate is just 37 cents per mile. Meals, we have our standard, it's $26 per day. And then lodging, we do require lodging receipts. So that's the only receipts that we require would be lodging receipts, unless maybe there was parking receipts or something out of the ordinary. And so now I'm going to talk about our charitable organizations. And so we do work with a lot of charitable organizations across the state and in surrounding states. And really what what the organizations do is they have an agreement with non-emergency medical transportation, and they advance expenses. So we have a lot of, recipients who have upcoming unexpected medical appointments. And so there are a lot of organizations out there that will provide upfront funding for recipients. And some of those would be, I'll just give some examples. A lot of the tribes across the state will assist, whether it be with mileage, lodging, or meals. We work a lot with hospitals and social workers, Children's Miracle Network, Ronald McDonald Houses. And so there's a lot of resources out there for recipients to get some assistance for their medical appointment. And many of those organizations, like I said, are willing to work with our office as well. And so NEMT charitable organizations, they do have a provider agreement. It has to be completed and signed by our office before we can provide any reimbursement. And so kind of how our process works a little bit with the charitable organizations is there is a request for medical transportation reimbursement form that we like organizations to complete. And we say it's really important for them to complete this form because we want to put a lock on those funds. So if a tribal organization provided $50 in money so that they could get to their medical appointment, we would ask that organization submit this form to us directly after they give the money to the medical provider, or to the recipient, I'm sorry. And then what we do is we put a hold on those funds. And so, once the trip is complete, those funds can go back to the organization. We want to make sure that all organizations are receiving their funds back so that they can continue to help families. And so I don't have a picture of our form, but if there is any organization on the line that kind of wants to learn a little bit more, we have our contact information at the end of the slides, and you're more than welcome to reach out to me or contact our office, and we can help get you set up to be an organization who wants to assist in this process. And so we like every organization to know that this is a two-step process. And so even when organizations are submitting this form and they're giving the funds out to the recipient, there is a second piece to this. The recipient still needs to submit the regular NEMT form after their trip is complete. And the reason that it's kind of like a two-step process is the first form is just saying, hey, I gave this recipient $50, and we put a hold, we put like a pending claim, and we put a hold on those funds. And the next step is we are waiting for the recipient or the family to submit their form so that we can verify that it's a Medicaid covered service, that they attended their medical appointment, and that all the requirements are met. And then once the trip is complete, those forms are sent into our office, and we process those accordingly as they come in based on the documentation that's received. If anything is needed, we'll reach out to families or to organizations to help get the required documentation. And so now I'll talk a little bit about our NEMT form, and that has to be completed for each medical trip. And so now this is the form that the recipient takes with them to their medical appointment. And on this form, it's a really basic form. We ask for Medicaid recipient information. We ask who the payment goes to, who took them to their medical appointment. Was it their neighbor? Was it their maybe it was a family friend that took them. They can indicate whoever they want the payment to go to. Some people ask that we split it between two people if it was two neighbors that drove together. They do have to answer the question of, did you receive any financial assistance? And so most of our recipients are really good. They say, yes, I received $50 from Children's Miracle Network. However, some recipients will say, no, I didn't receive anything, and that's where that travel advance comes in and is really important. So if somebody says, no, I didn't receive any money, we already know that money was received and needs to be deducted from this trip to pay the nonprofit that they received funding from. And so after that, we ask some trip information. We want to know where they departed from, which has to be their city of residence. And then we ask where they go. We ask them their mode of transportation. Did they take a personal vehicle? Did they take a Shriner's van? Did they take an IHS van? And so we ask a lot of those questions. We need to know who should be reimbursed, where that reimbursement should come from. And so we ask for lodging information. And then on the very end of the form does have to be signed by the parent, guardian, or the recipient. And we say this form has to be taken to their medical appointment. There is a section on the form to be filled out by the medical provider, and that's where it would be indicated that what the purpose of visit is, so we can determine if it's a Medicaid covered service. The medical provider will indicate if they have a referral on file. So any of those recipients who are on managed care or in the health home program, they can tell us right at that point that, hey, yes, I have a referral on file and this client did need to travel here. It was medically necessary. So we take all that into consideration and then we process our claims accordingly there. So our claims, we work all claims in the order they're received in the office. It does take, we say about 6 to 8 weeks to get reimbursed. So we are working on an online process right now to kind of help speed that process up a little bit, but unfortunately right now we do manually process these, and so it does take the 6 to 8 weeks. We process claims for the entire state of South Dakota for the centrally located transportation office. And so anytime after a claim's been paid, we do pay everything through direct deposit. We don't send any paper checks out, but we do mail pay claim statements. And so if there are organizations that are transporting multiple recipients, they are only going to get a paid claim statement, and they're going to get paid for 1 mileage. And so, like I said, if any additional information is needed, we'll contact the recipient and any organization that assisted with that trip to get any of the trip details that we might need to process that claim. And so the last slide is our toll-free number, and that is our NEMT staff. So anybody who answers the phone there would be able to answer questions. And then I also provided our website. All of our forms are available on our website. The nonprofit the travel advance form, as well as the non-emergency medical transportation form that the recipient would take with them to their medical appointment. And so that's really all I have for the day. You know, I appreciate everybody taking the time, and I am willing to answer any questions if anybody has any questions at this point.
If anyone thinks of any questions at a later time, you can shoot me an email as well, or contact as identified on the slide too, and we can make sure to get your answers for you. All right, well, thank you so much, and I do apologize for saying the wrong title for your program earlier on during the presentation.
I hear a little bit of background noise. Is there any questions that anybody has that I'm just hearing?
Okay, doesn't sound like it, but yeah, again, folks can be in contact, and we'll go from there if any questions come up at a later time.
Okay, perfect. Thank you.
Yeah, thank you so much. I appreciate it.